Hey, good afternoon, Matt. It's a pleasure to have you come on today to share Remodel Health and what we're doing with Educo Group and Team National and Impact Health on helping businesses cut one of the most significant costs in a business operations in the area of healthcare. And so it's a pleasure to have you come in today and share to our audience today how you impact businesses and reducing costs in that area. So, Matt, it's all yours.
Yeah, awesome. I appreciate it, Tom. Yeah, like you said, my name is Matt Bowden. I work for Remodel Health. I'm our senior engagement director at Remodel Health. Joined the team 6 years ago and have really just developed a passion to come alongside, work with organizations to help them significantly reduce their expense when it comes to their health insurance, to repurpose back into their business, repurpose back into their employees. And that's really how the relationship between Educo Group and Remodel Health was formed. It was really through Team National. Team National is a partner, and they operate and work with organizations to help reduce operating expenses, find cost management opportunities for employers. And health insurance is one of those key components that's really a stumbling block for many people. So it was a perfect marriage, perfect partnership to be able to join forces and work with Tom's team in bringing the Remodel Health solution to his clients and his organizations to really assist in that piece of health insurance. So really just a little bit about Remodel Health. So we're based out of Indianapolis, Indiana. We were formed to really come alongside, partner with organizations to help rethink employee benefits and how employee benefits have always been looked at, how they've been handled, and how they've been provided to employees. So Remodel, we are not an insurance company. We are not the ones insuring your employees. We are a third-party software and service organization that comes alongside and partners with businesses and evaluates your current state of health insurance. And we aim to have two main goals. So in our evaluation process, I want to have two primary goals in this evaluation. And the first one is we want to be able to provide a better benefits for your employees. At the very minimum, at least match the benefits that you currently have in place. We want to be able to provide a quality option that's going to care really well for your team. If we can accomplish that, the second piece that we want to look at is we want to actually help you guys save money. That's really never been able to be said in healthcare, is how can we provide a better benefit and at the same time save money? But that's exactly what we do here at Remodel Health. So we want to come alongside, really do an evaluation, and there's no commitment. It's just an evaluation that we run the numbers through our software and really see where your numbers come in. And if it makes sense, great. It opens that door to have a more serious conversation and explore kind of next steps and what that could potentially look like for your group. If not, I'll actually probably be the first one to give you a call and say, you know what, this probably isn't the best fit. Let's look at this a year or two from now, or as health insurance continues to change. So that's kind of our approach, our mindset, but our goal is deliver as much savings as possible to employers, employees, and still provide quality benefits. And we do that through a variety of different solutions. So today, you probably offer a pretty typical standard group health insurance plan where you work with a local broker, local agency, and you get to pick from a couple of different options of what might best serve your team. And you pick the plan, provide that to your staff, and great, it works well, it's simple, but it's super expensive. And we want to come alongside and say, well, what does it look like? Let's compare what you're currently doing. Let's compare the benefits. Let's compare the costs to a couple of different strategies. We look at what we call a wage up approach, and I'll dive into that more in just a moment. We look at traditional group health insurance to see if there's any other cost-effective solutions for you. And we also look at the new legislation that was passed about a year and a half ago called the ICHRA, or the ICHRA. For today's conversation, because it's most cost-effective, where most of our organizations are served well, we'll be focusing on our trademark solution called the wage up strategy. And really what this is, and kind of help unpack what this is, it's almost like blending traditional group health insurance with a self-funded plan. So the traditional group health insurance is kind of that foundation, the base layer, where we actually can help provide and identify a plan with normal deductibles, out-of-pocket limits, co-pays, co-insurance, just like you're used to today. And then if there's enough savings, or if you guys want to, employers oftentimes add in a few additional benefits where you can actually help reimburse towards your employees' medical expenses with a much lower liability and lower exposure than what we see in the world of self-funded or self-insurance. So it kind of blends the best of both worlds. And what we see, our average client, we work with organizations from 5 employees up to 800, 900 employees. And our average organization sees annual savings of around 20 to 30% on a yearly basis when it comes to their health insurance. Those upfront savings are incredible, but not only the upfront savings incredible, the year-to-year stability and cost stability of some of these new individualized approaches are really what drive home our model and make it attractive to employers, is because you no longer are in this game of managing risk, managing cost, because it completely stabilizes your rates year to year and makes a much more attractive solution and affordable solution for your team. But really, to kind of unpack what this looks like, the wage up strategy, we compare side by side and say, what would it look like to essentially cancel your group health insurance plan? That concept seems slightly counterintuitive. It doesn't make a lot of sense. But what we want to evaluate is group health insurance is how it's always been handled. What you probably don't know are all of the changes and legislative changes happening in the world of individual health insurance and how those plans are priced, and oftentimes much more competitively priced than group health care. So we actually look at what would it cost and what would it look like for your group as a whole to move away from the concept of a one-size-fits-all group health insurance plan and move into the wage up strategy, where actually through our system, we help you guys develop a budget. This is a defined budget that you guys now get to allocate towards your staff. Your staff members get to utilize this budget in our system to select the best individual health plan for their situation. And we actually do an analysis so we can help determine what plan can best serve your employees based on their individual needs. And then your employees enroll in those individual options. It's payroll deducted, so it looks and feels just like group health insurance. We provide all of the service and support to lift a lot of the burdens of healthcare off of your shoulders, your HR director's shoulders. And then we actually provide year-long support as well to assist your employees with any questions, support that they need throughout the year. So it looks, feels, functions a lot like group health insurance, while now leaning on and leveraging a lot of these administrative and legislative changes in individual health insurance, in allowing you and your employees to reap the benefits of how these plans are priced and driving home savings and putting money back in your pocket, but also back in your employees' pockets. So that's our goal through this, is to really provide an attractive approach for employers and their employees in this evaluation. And really what we draw this comparison to, again, we're not in the retirement planning space, but what we do in health insurance is very similar to the shift that we already saw happen in the retirement planning space. 30 years ago, 40 years ago, everyone went to go work for organizations for the pension. That's no longer the case. You're pretty lucky to find or stumble upon an employer that still offers a pension plan. Most organizations have transitioned over to the 401k model or 403b if you're a nonprofit. And really what they're doing is saying, we don't want to just leave our employees stranded, but we also don't want the complication, the cost, the headache of managing the pension, but we still want to help our employees retire. So we'll give them a budget or a contribution. They can invest that with the expertise and knowledge of a 401k rep on whatever plan best fits their needs. That's exactly what we're doing in the world of health insurance. We're helping develop a budget. We provide our expertise, our knowledge and support in selecting a plan, And then we give all of the support throughout the year as well, so that burden doesn't fall on your shoulders. So that's exactly the transition that we're seeing take place. Hundreds of thousands of organizations and employees are moving in this direction, and Remodel Health is really at the forefront of a lot of these changes to create this innovative and unique approach to benefits while still giving all of the same structured quality benefits that you get with group health insurance. And really, you might be listening to this like, well, this seems way too good to be true. You're telling me we can get better benefits at lower costs. How is that possible? And really, this is one of the opportunities that helps drive the cost down for employers, is how individual plans are priced differently than group health insurance. Oftentimes, group health insurance is what's called community rated. So based on the health of your employees or based on the health of other local organizations in your area, health insurance carriers give you a community rated plan. And that plan, you're kind of at the mercy of the health insurance company. Here's the rates and here's the benefit you get for those rates. Individual health insurance is truly priced based on each employee's household. So it's tailored to their specific situation, their financial needs, their financial situation. And you can see right here, here's a couple of examples through Blue Cross Blue Shield plans. This is an example of a family of four making $70,000. So a couple with two children making $70,000, they could go out, and if they said, hey, we're pretty healthy, we don't go to the doctor too often, we would love a high deductible health plan that we could reinvest money back into a health savings account and grow that money tax-free. This is not a joke. This is the reality of individual plans. They could get this high deductible health plan for $0 a month, because based on their family size, their age, their zip code that they live in, and their income, they can qualify for premium discounts or tax credit discounts to reduce what is due to the health insurance company. So that is truly a $0 plan cost that they would be responsible for in order to secure this coverage. If somebody said, hey, well, I want the gold plan, I want $1,000 deductible, I want co-pays, I want co-insurance, they could go get $1,000 deductible in this area. And keep in mind, individual plans, they vary by state, they vary by county. It's not always going to be a Blue Cross Blue Shield. There are many different options, usually 30 to 40 different options available in most areas that I operate in and work with employers. But in this area, somebody could get $1,000 deductible for a family for only $599 a month. Again, I don't know what you're currently spending today on your group health insurance, but I am aware of many of the trends, and of what I'm seeing on average is family plans are typically costing at a minimum $1,000, on average closer to $1,500, and I've seen family plans cost as much as $2,000, $2,500 a month for a family to secure that health care. So this $0, this $599, this is the true premium cost before you as the employer even provide a budget or allocate a budget to that employee. So if you think of how cost effective this can be, it helps you as the employer lower your expense. It helps the employees lower their expense. And overall, that's what's driving such a large amount of savings for organizations when they make this transition. So we do an evaluation of your group, and we do an analysis to really make sure this is the best fit for you and your employees. We don't want you guys making a loose decision, a decision based on any assumptions. We truly want you to have everything that you need in order to make this decision, because we want it to truly be in the best interest of you guys, the best interest of Remodel Health, and we want to care for your team well. But once we do that analysis, we can actually help develop pathways of where people would be best served based on their individual information. Most employees, probably 80 to 90% of employees, are going to be best served through the individual marketplace or alternative sharing plans, such as impact health sharing. The individual marketplace are your traditional health insurance plans like we just reviewed on that previous slide. Impact health sharing is an incredible resource, an incredible organization. that provides extremely high quality benefits at a very reduced cost for employees. So it's a great way to manage claims, manage costs of your health care, but not pay an arm and a leg for your monthly premium. So that can be a great alternative for employees that's a good fit for. I'm not saying every single one of your employees would qualify for that or that would best serve them, but we want to open up options for your staff to truly do what's in their best interest and really serve them and their family well. And by providing some of those options and more than just your marketplace options, that can serve families extremely well through this transition. So that's where most people would fall. But Remodel Health, we want to go kind of that extra mile, and we want to evaluate alternative options to truly make sure employees are doing what's in their best interest. You might have some employees today say, hey, I have a spouse. My spouse works, has great health insurance available through their employer. Great. Maybe they could utilize your budget and use that to cover the cost of their spouse's health plan. And if that's where they're best served, we want to help them move in that direction. Same if somebody is over the age of 65 and they can qualify for Medicare. They've been paying into that their entire lives. It's probably time for them to reap the benefits and truly utilize the extremely high quality benefits that are available to them. And your budget can assist in that cost and help even cover the supplements associated with Medicare to serve their family well. So we don't really care where people end up. We just want their families to be well served and cared for in this transition to make sure nobody is hurt through this process or this change of rethinking how you offer your benefits to your staff. And once everyone is enrolled in a plan, it doesn't just end there. We want to provide all of the service support to assist in this transition. So we actually provide what we call a member care coordinator. This person is designated to your group, your employees, to support any questions you have, any questions your employees have throughout the year. So they're not knocking on your door. They call Remodel Health. They call their personal care coordinator. They have their direct phone number, email, and they're there to support them throughout the year. That person is also there administratively for you. If you have questions about hiring employees, terminating employees, that person is there to assist you in those transitional periods. One of the huge benefits is there's no more COBRA administration for the health insurance. These are individual portable plans. Employees get to take them with them, and we get to reach out and say, hey, looks like you're no longer employed with ABC company. If you like your health insurance, you're responsible for the full premium payment and you no longer get the budget, but you can take that with you and your family can have that benefit wherever you're going next. So that's a huge benefit. In the initial review process, again, like I mentioned, we're going to help develop a pathway based on the analysis of what plan we think would truly be most impactful for your staff. If somebody says, hey, that plan's good, but I think another plan might better serve me, they have the ability to raise their hands and say, hey, I want to look at different options. And we'll actually assign them a personal benefits coach to work alongside them and their family to navigate the different health insurance options available to truly do what's best in this season of their life. And they get to reevaluate that every single year. As health needs change, as financial needs change, they can reevaluate the plan that they're on to truly do what's in their best interest on an annual basis, year after year. Ancillary plans, we can assist in managing your ancillary, your dental, your vision, your accident, life, whatever that may be. We can assist in providing additional support. We can manage the ones that you currently have in place, whatever that may be. Usually employers make pretty minimal changes to those, but Remodel Health can help support those, support your employees in those as well. And then lastly, this is a smaller benefit, but one that actually gets an incredible amount of utilization, is Teledoc. In addition to all of our support, in addition to us helping with the health insurance, we'll actually purchase and provide Teledoc for all of your employees. And that's good for everyone living in their household. And really what Teledoc is a resource that you can call in 24/7 for $0. It's a $0 copay. And you can call into a doctor, speak to them over the phone. You can speak to them over FaceTime, and they can prescribe non-narcotic prescriptions over the phone. So great resource, especially in today's day and age of where telehealth is extremely popular. This is a great resource to have a $0 copay in utilizing these services. So really at Remodel, like I said, our goal is we want to provide as much support to really just care for your team well and deliver just an incredible amount of savings to the organization. So really appreciate you tuning in. This is a pretty high level. Would love to chat with you further if you think this is something that would benefit your organization. And in the email that you received, you'll have the resources available. So this is kind of the quick introduction, the high level. What we would like to do next is actually run some numbers for your group. Still at zero commitments, no financial commitment. We just want to run your numbers. And you'll see on that email that you got, you have the Remodel Health Census template. If you could please fill that out with names, date of births, pretty generic census information. That is extremely helpful in us running some accurate numbers to present to you. One funny piece of information that we do ask for is employee income. The only reason we ask for that is because, as we saw earlier, individual health insurance is priced differently, and income is one of those pieces of how it's factored. So that will be really important in delivering more accurate numbers to you guys as a group. So if we could get that completed census, if we could get your current summary of benefits and the pricing of your current health insurance plan, that's everything that we need to plug into our software, our system. I'll generate a proposal, and then we'll follow up, schedule a meeting to walk through those next steps, numbers with you to really see if this makes sense for you guys to further evaluate. So really appreciate you tuning in. Really excited to evaluate this with you further. And if you have any questions at all, reach out to Tom or myself, and we're happy to accommodate that. But really, in order to really identify, we'll need that census data to plug it in to see where you guys fall compared to what you guys are currently doing today. So thank you so much. Hope you all have a great day, and looking forward to hopefully hearing from you soon. So take care, and we'll talk soon.